Good morning, dear professors. I think we have to start our session. It's about roundtable discussion about artificial intelligence in audiovestibular medicine in New Frontier. The moderator will be covered by Professor Dr. Dalia Hassan, Professor of Audiovestibular Medicine at Ain Shams University. Please, Dr.
Good morning, professors and colleagues. I welcome you all. We are going to start our activities for this day, interesting day in the Ain Shams Medical Congress about a roundtable, artificial intelligence in audiovestibular medicine in New Frontier. The roundtable will be moderated by myself, and the guest speakers for the roundtable will be Professor Dr. Hisham Kuzu, an eminent figure in the artificial intelligence and the IT technology from long time ago. And this may be my first way of communication with Dr. Hisham Kuzu about 20 years ago in the DAD about the IT. But this was before the audiology, actually. Yeah. And also Professor Dr. Wafa, Professor of Audiovestibular Medicine at Shams University, Professor Dr. Hisham Taha, Professor and Head of the Audiovestibular Unit at Shams University, my dear colleagues, Dr. Noha Shafi, Assistant Professor, Dr. Abir Mohammed, Lecturer, and Dr. Lamis, Lecturer of Audiovestibular Medicine at Shams University. Terrible and frightening development in the way of communication since the beginnings of human. And of course, the ear and hearing sense is the main communicating channel. This era and this progress involved this section in medicine, and led us to go to the computational audiology. Computational audiology, it involves the augmentation of traditional hearing healthcare by digital methods, including AI and machine learning. It has the potential to dramatically advance audiological precision and efficiency to address the global burden of hearing loss. And AI has changed the way medical professionals are working and how they arrive at decisions. Of course, the same is true for hearing healthcare. Do we need, and why do we need the implementation of AI and other innovations in medicine in general, and in turn in the hearing healthcare? And this was the scope and the aim of this roundtable. The diagnosis and treatment, and this will be highlighted by my dear Professor Dr. Hisham Kuzu, about the role of the AI in general medicine, about the types of AI and machine learning. The diagnosis and treatment of hearing disorders are often problematic. The primary difficulties arise from the multifactorial nature of the disorder, together with the limited understanding of their mechanistic underpinnings. A particular perceptual impairment can be associated with many different pathologies, and a particular pathology can be associated with many different perceptual impairments as well. So AI can help to show the links between pathologies and perceptual impairments to improve diagnosis, treatment, as well as the advance in understanding the fundamentals of hearing and provide insight in the causes of complex disorders. What's the present situation of AI and hearing and audiovestibular disorders in general? The changes is proving to be much slower than other sectors of healthcare. Why? And this what we'll get an idea about it at the end of the session. And I found one of the systematic review talking about the AI and how its power in transformation of hearing healthcare and research. And they divided the sectors and the challenges, top challenges related to hearing. Starting from the middle ear. These are the left row, or the first left row represents the disorders or the areas in hearing healthcare that were explored in this review. Treatment of middle ear conditions, automated audiogram, fitting hearing devices, speech devoicing hearing devices, cognitive control, multimodal integration, treatment of profound deafness, automated translation of language, treatment of tinnitus, and artificial auditory systems. And the third row represents how many people need such assistance. And the fourth or the fifth row about the technology readiness level, the level starts from 1 to 9, and we will find that the 9 only settle down in automated audio. The technology readiness level from 1 to 9. 9 means it's already have been innovated and applied. 1, it's no, just in theories. So we'll see that the automated audiogram measurements now have been applied, have been self-led, and have been used. And there are many applications on the mobile and even on the iPad to do audiological testing or hearing tests, simple pure tone hearing tests on this device. The same exists for the artificial auditory systems that exist. And followed by the hearing aids, the hearing devices, and the speech devoicing of hearing devices. It's already in the mid-level. We know that many companies have implemented it and start using it in a broad way. But all the other areas are still in their early stages. The tinnitus, even the audio, the vertigo is not being mentioned here in the review, maybe because it's little bit 2022. And we'll hear from Dr. Hisham Taha and Dr. Noha Shafi what about the AI in the vertigo. And my speakers, or the speakers for the roundtable, will be started by Professor Dr. Hisham Kuzu, giving us an intro about AI in general health and its different types, followed by the role of hearing devices by Professor Dr. Wafa Al-Khouli in cochlear implant and Dr. Abir Mohammed in hearing aid industry. After that, Professor Dr. Hisham Taha and Dr. Noha Shafi will give a rise about the AI in vertigo. And last but not least, Dr. Alamis, AI in central auditory processing disorders. And now the floor for Professor Dr. Hisham Kuzu, please.
Bismillah ar-Rahman ar-Rahim. Good morning. Professor Daria, thank you very much for the invitation to be with you in Ain Shams University Medical Conference. I'm proud to be here. And I always start this presentation with this slide that the future is here. Artificial intelligence is our future, either in medical practice or in any other industry. Artificial intelligence is the future, and you have to know that to be an artificial intelligence aware and maybe expert in artificial intelligence in your business as a healthcare provider. So we live in a technology-driven society, as you all know, that technology shapes our lives, and technology makes our lives different every day. And we have 5 industrial revolutions, and the 4th industrial revolution was starting this at the beginning of this century, and 4 technologies, including the AI, make the 4th industrial revolution into a 5th industrial revolution as we live now, having the human cyber physical system, we call it. And these 4 technologies are the artificial intelligence, of course, and the internet of everything. This is the start. The internet is the start of why AI is now prevailing. This is the start, internet of everything, that everything is connected through the internet. Even people are connected through the internet. And maybe in the very near future, every one of us will have at least one IP or internet protocol address, like computer devices and everything. So internet is the start. And as a result of the internet, there is a big or massive data that cannot be analyzed with the conventional data analysis techniques or methods or tools we use. So there is there should be some sort of big data analysis or data science or data mining that can analyze this huge sum of data. And finally, these data need to be secure. So we should have a secure system, and this secure system, or the most secure system in the world, is the blockchain technology that's used now in every all banks and financial systems in the world are using the blockchain technology. And we'll talk about this in a couple of minutes. Internet of Things means that it's not data, it's not processes, it's not things or services. Also, people are connected, and we call it connecting the unconnected. That means that we are always online. We will be always online, 24/7. This is the future. That you are connected to the internet. Your car is connected to the internet. Your refrigerator is connected to the internet. Everyone in your family is connected to you and to the internet. So it's like we are always online. And this is called ubiquitous. Ubiquitous means being everywhere, anytime. This is the meaning of ubiquitous. So we will have ubiquitous life, ubiquitous healthcare, ubiquitous financial systems, ubiquitous learning. So the world will be ubiquitous, that you are connected anytime to anything you want, if you have the access, of course. And the result of big data needs, as we mentioned before, that the analysis of this big data needs to add some information or even knowledge to the data, to the raw data. And this is what's called data mining. Data mining means making the raw data, very big data, raw data, turning them into meaningful knowledge or meaningful information. And this is the aim of this data analysis or data science analysis or data warehouses, many names for this. So it's data mining, and we have passed 4 stages of data analysis. The first stage which is answering the question, what happened, which is a descriptive analytics, and then why did it happen, which was diagnostic analytics, and now we answer the question, what will happen, which is predictive analytics. We can predict the future through data mining of the available data. You have it now, and the future will be how can we make it happen, or prescriptive analytics. So you can find solutions for the future problems through analyzing of the current data you have. And that's why artificial intelligence become important, because you cannot process this huge amount of data without the use of AI, without the use of computers that think faster and more accurate than the human brains. This is AI. So AI is needed for the big data analysis. The blockchain technology, as we said, it's a secure system that secures the data that in the air will be data. All the data of the world will be in the air, and the blockchain technology will add security to this data. I can tell you that this is, to summarize the blockchain technology. It's not easy to understand the blockchain technology, but every block in the system or transaction, every click you do is a block, and this block has minimum 10 keys. It's considered like a safe, and a safe has 10 keys. And every key is with one person, and these 10 persons are scattered in the world, and they do not know each other. What is the possibility of opening the safe and seeing what's inside? It's almost impossible, because the 10 persons do not know each other. This is the blockchain technology. It's keyed or secured with different keys present in different servers in the world, and you cannot delete, mutate, change any block. The block is forever present with the time, with the author with everything present. So it's a very secure system. And now the artificial intelligence, I always say it's al-zaka al-istinai. I always, it's in Arabic, because some people say it's al-zaka al-sinai. Al-zaka al-sinai is industrial intelligence, and this is something totally different than the artificial intelligence. It's al-zaka al-istinai. What's artificial intelligence? It's a branch of computer science concerned with making computers behave like humans. This is the initial concept of artificial intelligence about 60 or 65 years ago, that this is the concept, the machines that think like humans, that behave like humans. Actually, this is not the current concept of artificial intelligence. And they said that humans can sense, so computer can sense either vision or hearing, audio processing. They can comprehend, so language processing, knowledge representation, and they can act, machine learning and expert systems. This is the initial concept also. But the humans are not machines, and machines are not humans. They think, behave differently, totally. And that's the new concept of artificial intelligence. It is the ability for a computer to think and learn, not like human, because it will never be a human. So think and learn. So it's a systems that think, act rationally, and not like humans. But this is the old definition. So this is the new definition of artificial intelligence. We used to get benefits of artificial intelligence more than 30 years ago. We do not know that it's artificial intelligence, but it's present in every application we do. The junk email in your email is done by artificial intelligence that identify a spam email or junk email and remove it to the junk email. This is artificial intelligence, and many other things we are using as artificial intelligence. We do not know. There are 4 main types of artificial intelligence regarding the functionality. So this is the most common type. It's reactive machines. That it follows the rule if, do. If you find this, do that. If you find this, do that. This is the reactive machine, and this is present in most of the computers. And this is number 1. It's follow task oriented. And number 2 is limited memory. Here, no memory. And here, there is a limited memory. There is a memory. The computers collect previous data and add to the memory, and they can learn from the memories. They can learn from previous experiences. And this is what's called machine learning. These are present now. The third type, which is theory of mind, they understand thoughts, emotions, and interact socially. This is partially present now. The part of this theory of mind, that they can interact, they can socially interact, and they understand your language and they respond in your language. The fourth type, which is not present till now, the self-aware, and they are intelligent, sentimental, and conscious. And this is the major risk of AI, that computers or robots or whatever, they can sentimentally behave, and they have awareness or consciousness, self-awareness. There are also 3 types of artificial intelligence regarding the capabilities. The main type is the narrow artificial intelligence, or artificial narrow intelligence, and this is what's present today. It outperforms humans in specific repetitive functions such as driving, medical diagnosis, and financial advice. And this will increase the jobs needed. It need to jobs enhance it, because you need artificial intelligence to enhance your job, and we need more jobs for artificial intelligence use. So this is what we have now. This is present now. The second type, which is wide or general artificial intelligence, it's supposed to be in 2040, after 15 years from now, maybe less, maybe more. But when the wide artificial intelligence is there, or general artificial intelligence is there, they compete with humans across all jobs, such as earning university degrees or convincing humans. That's everything is human. They can compete humans in everything, and now jobs can maybe at risk now at that stage, but we do not reach that stage yet. But maybe we can reach it. And the final type, which is super artificial intelligence or artificial super intelligence, this is the one with self-awareness. So this is the humanity is at risk, not jobs. All the humanity is at risk. You know, this is the rise of machine. You know, this movie, The Rise of Machines. It's like something like this. This may not happen, but this will be 5 to 10 years after the wide artificial intelligence. So maybe 2045 or 2050, we can see this disaster. I'll skip this. Of course, there are advantages of the artificial intelligence. You all know the most of the advantages, but it's no error, no human errors, no bias, no risks, never infected. Never sleeps, availability 24/7, very fast and very accurate. So it can use in repetitive tasks, not bored at all. So in healthcare, we can use artificial intelligence in boring, repetitive tasks. So artificial intelligence has many advantages, but also it has disadvantages. One of these disadvantages is high costs, of course. To create an AI environment in any organization, you need a high cost, at least now. Increased unemployment. Some jobs will be taken by the artificial intelligence or robot that doing these repetitive tasks. Lacking creativity, and this is the main issue of AI in education, that you can, with just a click, you can have a thesis of 200 pages on certain topic with references, with everything. So the creativity, this is the issue, the main issue with AI in education. Lacking improvement, no human replication. But these are the disadvantages, but the risks, some risks for the AI. The machine learning have many types. We'll see this now. Some of this machine learning were called deep learning. They have multiple layers of data processing. And these layers are learning from previous experience of the computer, of the device. The inventor of this device does not know how the machine can perform this data analysis through these multiple layers. So maybe it is biased somehow. Maybe it's not accurate somehow. Maybe we do not know what's going on in this multiple level deep learning. Of course, some security issues, some ethical concerns like in education, and also if unregulated AI use lead to unforeseen social impacts. We do not know how AI will affect the social or the society. We know how internet affected our society. We know how the mobile affected our society. We do not know till now how AI will affect our society. There are many branches of the AI, of course, including machine learning and deep learning, robots, language processing, expert systems, and many other branches. We'll talk about machine learning. Machine learning means that they are algorithms and models enable computers to learn from data and make decisions, predictions, without explicit programming. So the computer, the difference between computer and AI, computer follows a program, an algorithm. You give the computer an algorithm, it's if, do, and the computer follows the algorithm. AI, no, not following the algorithm. They are following their learning, their previous experience with everything. So They are not following the programming algorithm. To know what's the difference between machine learning and deep learning, I'll give this example always because it's very easy to understand. For the machine learning, you learn the machine, the computer, to know if this is a car or not. So you give the computer a photo of this and tell, is this a car or not? And the machine has a model for the car. It has some body, 4 wheels, something like that. And they identify the photo. And for the machine learning, it says some features extractions and classification. And it says, yes, it is a car. Or no, it is not a car, if it is not a car. But for the deep learning, it imitates the human brain. The human brain has multiple neural networks that process the data, and that's present in the deep learning. So we have multiple layers of feature extraction and classification. And after you give this picture, it does not tell it is a car or not. It can tell you which model, which year of production, and if there is something special about this car. So this is deep learning, how deep learning is processing. And of course, it can be used in healthcare because it's very important in healthcare. All deep learning facilities. So it is, we call it AI cognitive skills. AI cognitive skills. It can learn, it can reasoning, and self-correction. This is important for deep learning. They can learn from their mistakes and they can correct themselves. And on the natural language processing, we all know the use of all chat applications are using the natural language processing. They can comprehend your language and respond to your language, and many other applications for the natural language processing, of course. And now the human vision or versus computer vision. Computer vision is one of the applications of AI, and it's the same like the car. It identifies the picture of the car, and here also it can be identify any object, but it is important. Of course, all the traffic cams in the streets are using the computer vision of AI. You know this, and this there is also what's the face recognition. It's present there, and it uses deep learning in identifying the object, even if the object are so similar. Like this example, we have a cat and a catty dog. They can, using these multiple layer to see if it is okay, it is a dog or not, or a cat or not. This is important in face recognition, as we said. Some agencies know by face recognition where is any person in the world if they have their face present where and last seen when. From the computer or the traffic cameras all over the world. And this is important also in radio diagnosis. How AI and Internet of Everything changed the health. First, we have what's called e-health solution. The story of digitization in health started by what's called e-health solutions or الحلول الرقمية للصحة. And these were stationary computers, stationary stations. They are stations. The healthcare provider goes to the station and inputs the data. This is the first, we started like this. And then it became M-health solutions or mobile health solutions. And the healthcare provider has the personal assistant device or a tablet or mobile or it's mobile. They can go anywhere. And now we have the U health solutions. And what U stands for, as we said earlier, it stands for ubiquitous. So we live in the ubiquitous healthcare solutions. That means that you can access the healthcare system or the healthcare data or whatever, anywhere, anytime. If you have the access, of course. If you have the access, because you need access. This is security. It started by what's called telemedicine. Telemedicine was the use of ICT or internet communication technologies for remote clinical services. You give diagnosis, monitoring, or even management through the telemedicine. And this was start of the electronic health solutions. And then added to the clinical services, the non-clinical services, including education, training, continuous medical education, administrative stuff, in addition to the clinical services, and this is called telehealth. So it starts by telemedicine and then telehealth, which is a larger umbrella. And this telehealth turned into e-health with the addition of all the AI uses or healthcare surveillances, healthcare services, healthcare literature, everything in health, make it e-health. So e-health is a larger umbrella for this. And now we live in the era of digital health, thanks to the Internet of Everything and AI. So we have what's called digital customer. This is an expression used for many industries. So with AI and Internet of Everything, we now live in the digital health era. And we call it this transformation from e-health to a digital health is digital transformation or تحول الرقمي. And this one step behind what's already going on in the world. We now going to what's called cyber transformation or تحول السيبراني. Because of the Internet of Everything and artificial intelligence, we are a small village. The whole world is a small village, and this is what's called cyber transformation. So every part in this world will be connected through this cyberspace. So if we apply this to the health, this is the future of healthcare. Simply, very simple. You know, when devices are connected together, we call it LAN or local area network or intranet. Sometimes we call it internet. Some computers connected through a server and you can access the computers. This is LAN. For the human, it's BAN. It's body area network. It's body area network. That is connected sensors all over the body that collects health data from this subject or from this body. You know, some watches, my watch can measure the blood glucose, can measure the blood pressure, can measure the pulse or respiratory rates and many things, and can give you sometimes alert that you have a dropped beat of your ECG or something like this. So this is one of the sensors that can collect your health data and send them to the second layer. This second layer, which is the user interaction interface. It's a mobile, it's a device, it's a whatever that collect this data and sends them to this third layer. This third layer, which is what's called DMU or decision-making unit that analyze the data, classify the data that's sent, and decide if it is emergency, if it's not emergency, if it is important or not important, and go to the fourth layer, this where to apply the alert to the physician, hospital, emergency department, whatever. So this will be how healthcare will be in the very near future. Some systems in the world are working with like this. Of course, computer vision is important. I'll give you some very striking example for this. This a retrospective study for a maternity hospital that's going to do screening mammogram for all ladies across the years, and they extracted those diagnosed as cancer breasts and gave these photographs, these images to AI machine. And the AI machine can diagnose this breast cancer 4 years before the human eye can detect the tumor. 4 years. Imagine the prognosis, imagine the early detection. So this is how artificial intelligence can help us, especially in radio diagnosis. Of course, there are many types of medical robots. No time to discuss all, but we have surgical assistance robots that do some tasks of the surgery, or even the whole surgery now can be done through robotics. We have the modular robots that replace limbs or for patient rehabilitation. We have the service robots, many services that can do certain service in the hospital or in the organization, like nursing robots. These are nursing robots that prepare the patient for the surgery. They can do everything the nurse can do to the patient. Robots in the supply chain, in the pharmacies. Social robots, of course, we have social companion robots that can be with the children or the elderly, care of the elderly. And we have disinfected robots, and this was important, of course, in the epidemic area, that they can, as we said, that robots are not infected, they are safe, so they can disinfect the organization or the hospitals. Autonomous robots, of course, we can use some physician to have remote management or remote monitoring. And also we have ingestible or nano robots, and this is the future also in some medical interference, that you can have a robot that through the injection or through swallowing the robot, they can diagnose and even manage the condition using nano robots or ingestible robots. Robots has the future very few applications, and they have the same advantages of AI, of course, but they have also some challenges. Consider that you are going to a dentist and they told you that the doctor is a robot and he will remove your tooth. Would you agree? Anyone would agree that a robot extracts their tooth? For me, I will not agree. So this is a lack of patient trust. This is one of the challenges. Lack of skilled professionals, because robots are coming to help you. So you need to know how to deal with these robots. So this is a skilled professionals, and also some safety issues, of course. AI has many applications in healthcare. You say, name it. And for the healthcare systems, the healthcare system as regarding the country or the nation, every part of the healthcare system can use AI. So the consumers, the providers, the payers, the insurance companies, the pharmaceutical companies, and talking about the pharmaceutical companies, AI in pharmaceutical research can help what's called precision medicine or individualized medicine. So you will have a drug that is tailored or individualized to this particular subject. So you will have antidepressant without side effects. You will have antibiotics without ototoxic effects. This is the use of AI in pharmaceutical research. And now finally, humans, AI is great at solving problems, but humans are more advantageous for AI for the creativity and abstract thinking abilities. So the take-home message: AI or machine learning will not replace physicians, but physicians using AI will soon replace those not using it. So it's important to know AI and the application of it. AI will not replace physicians because we cannot replace empathy. Physicians have a non-linear working methods. Complex digital technologies require competent professionals, and there will also always be tasks, algorithms, and responsibilities robots can never complete. And finally, it has never been technology versus human. It's technology for human. We invented technology to help ourselves. Thank you.
Thank you, Professor Dr. Hisham Kuzu, for the very interesting topic. Actually, thank you for the presentation. Thank you for the take-home message, which is very important. This topic will be artificial intelligence and cochlear implant journey, presented by Professor Dr. Wafa El-Khouli, Professor of Audiovestibular Medicine at Ain Shams University.
Good morning, everybody, and thank you very much for Dr. Dalia Hassan for inviting me to this nice session, and thank you very much for Dr. Hisham for introducing and giving this nice presentation. Actually, I would say after hearing the presentation of Dr. Hisham, this is a work that is a good example of predictive analysis of AI. And I was fortunate enough to be part of a group working in this area in cochlear implantation, developing a scoring system for prediction of performance of cochlear implant children. This is a group work with Professor Dr. Ala Abu Sitta, and thank you for coming today. And my colleagues at the phoniatrics and also mathematics department at Ain Shams University, Tanta University, Suez Canal University, and thank you for coming and attending this presentation. The objective of this research was that cochlear implant candidate selection is, as we all know, is a healthy, complicated process that entails subjective judgment on the interaction of multiple preoperative variables. So we have lots of preoperative variables, and when we are faced with any child, we are thinking, will this child be one of the good performers or not? Or will there be a different outcome than we expect? So it is assumed that setting a scoring system for the process of cochlear implant candidate selection would help in precise and reliable decision making. The thinking behind this project was that we have a much variability in the children's performance because we have a group of variables which are present in the patient before the cochlear implantation. So what we were aiming to is that, are we going to use the artificial intelligence to predict the performance of a child, whatever the child is coming with, taking into consideration the many variables that the child is coming with? So first of all, we look into the child's performance, the outcome measure after cochlear implantation. Is he good or not? And this will depend on the group of variables preoperatively. And what we are questioning now is, can we predict the performance of the child, of a given child, taking into consideration the group of variables that were present within hand before the cochlear implantation or not? So this was a retrospective cohort study held out in 3 post-cochlear implant rehabilitation centers. A total of 100 children records were analyzed with 2 statistical methods: the conventional one and the AI using machine learning. The performance was assessed for children who completed at least 1 year after rehabilitation. The outcome measures were language age deficit, phonological deficit, and social deficit, and these were invented in the research in order to make them as a new measure for the cochlear implant performance, used to represent the developmental delay of those children in a single numerical value. And we chose to have it a relative measure rather than an absolute measure in order to be more precise. Language age deficit, this is the difference between the chronological age of the child and the corresponding language age at the time of testing. Same for phonological deficit and same for the social deficit. And according to this, we classified the children into classes according to the degree of deficit: slight, mild to moderate, moderate, and moderate to severe delay, and severe delay. and then we distributed the children according to the classes that we had invented. And as you can see here, these two groups, the phonological deficit and the social deficits, there is much irregular or unbalanced distribution of children within the classes, not like the language deficit. And that's why we chose or we predicted that the artificial intelligence would help in this, taking care into consideration this imbalance of distribution of the patient. These are the studied variables. There are 45 variables, preoperative variables for each child, and we entered this data and then we started the analysis. The statistical methods was divided into two groups. First, the data management and statistical analysis. The data was entered into first the conventional statistical method. And we did the descriptive data for the patients and the correlations and linear regression models. And in the same time, we took this data that we have for the 100 children and we entered it into the machine for artificial intelligence, machine learning. And as Dr. Hisham has said, first we start with the feature importance and then we do classification and then regression analysis related to the artificial intelligence, like the similar to or to be compared with the conventional statistics. There are main evaluation matrices that we have used to evaluate the classification models and calculate the error, and these are the accuracy, the prediction, the sensitivity, and the F measure. And after that, we calculated the mean absolute error. But the most important thing is that we calculated the coefficient of determination, which is R square. And this is used to measure the relative closeness of the predicted values to the actual values. Yani, after we did the analysis with the AI, the predicted ones are equal or similar to the actual ones, or how are they far away? So R2 or R to the power 2 has a value between 0 and 1. A higher R square value represents a higher accuracy of the predictive model. So the higher the R2 value, this would be better for prediction of the results. For the conventional statistical method, we did linear regression analysis, and for the three output measures that we pointed, the R2 values were 0.4, 0.3, and 0.26. And these are low predictive values because they are much lower than not approximating even the one value. And why? Because their ability to explain the conventional statistical methods, their ability to explain variance of hearing outcome is limited, as linear models are capable of capturing only linear relationships between variables, which is not the case here. The artificial intelligence, on the other hand, used to compute the patterns of interaction between the variables, whether linear or nonlinear, in the presence of this huge amount of data, is much preferred. So these are the steps of artificial intelligence, like Dr. Hisham has said. First, the feature importance. We compare between the different variables, and then we do the class balancer filter, which is used because the data was not balanced within the groups, and then the model training, which is devising the model, and then predictive score, in which we took a part of the sample and we tested it using the model, and this is internal validation for the model itself. And these are the results that we got. First of all, the variables or the feature importance. The machine learning model was capable of applying, after applying was applied to the whole sample, which is 45 preoperative variables. Only 23 variables were found to influence the outcome deficits, and were arranged from the most important to the least important. And the most important variables here were for the population, for our population, was the duration of auditory deprivation and family support, and then other variables after that. Of course, take into consideration this is only 100 patients, data for 100 patients only. This for the artificial intelligence, this is a relatively small number. This is not the fact, and we can get different variables or importance of different variables if we apply larger number of data. So for the artificial intelligence classification model validation R2, these were the predictive accuracy. For the language age deficit, it was 56.6. For the phonology, it was the highest, 88%. And for the social deficit, it was 40%. And because we explain this because specifically the social deficit is related to the way that we collected the data, and it is depending on the subjectivity of the responses of the parents, and that's why it was not that efficient, and also the sample size is low. But generally, the artificial intelligence analysis surpassed the conventional statistical methods for the prediction of outcome measures of post-cochlear implant performance. So in conclusion, this work succeeded in creating a framework for predicting scores for cochlear implant outcome using machine learning based on language age deficit, phonological deficit, and social deficit. The traditional statistical methods succeeded in expressing the descriptive data and linear correlations, but failed in creating reliable predictive scores for the deficit outcomes. Although the machine learning classification model's accuracy for language age deficit and social deficit was still less than 70%, it can be enhanced by obtaining more data, allowing for more model learning. The more data, the more accurate the prediction will be. The present situation and future plan, we consider this work as an initial and crucial step in the cochlear implant field, hoping it would help in obtaining objective decision-making regarding the cochlear implant candidacy selection. Actually, in the present, a software has been created based on this research, and the multi-center study is ongoing now in a number of cochlear implant centers in Egypt and in the Arab world. And as more input data is being fed into the system, the accuracy of prediction of the model will hopefully increase. This is the publication of the research that we have done. And I would like to thank the research group who shared in this study, and parents of the children who agreed to provide their children's data. And thank you for listening.
Thank you, Professor Dr. Wafa, for this informative presentation. I now invite Dr. Abir Mohammed for her presentation.
Okay, my talk today will be on artificial intelligence in hearing aids. AI is designed to enable machines to try and simulate human intelligence in problem solving, logical reasoning, and managing complicated problems. So it tried to, by sensing the input, processing the information, developing an action, and learning from experience. And as Professor Dr. Hisham said, we have artificial intelligence is the broad category, which includes machine learning. Machine learning is the system learns automatically and enhances its performance through the analysis of provided data. And the subcategory of the machine learning, which is considered one of the powerful algorithms in machine learning, is the deep learning. The deep learning or deep neural networks use algorithms inspired by the brain biological structure and functioning, enabling the system to learn and respond to information with increased complexity and precision. I will give an example on how this is used in hearing aid digital processing. Example of the use of deep neural networks in denoising algorithm in hearing aids. First of all, we have the training stage. The training stage, we need large recordings of speech and noise, different diverse recordings. This will include, or this will develop mixed speech. or noisy speech, the DNN algorithm, using different parameters, will try to clean the speech or do have a clear signal, which is the clean speech. This clean speech will be compared to the target speech or the true speech, which is the clear speech without the noise, and it will learn from its mistake. It will calculate the difference between both the output and the target, and it will learn from its mistakes to further enhance the parameters and more fine-tuning to obtain better or optimize the outcome. So here we have, it sends the input, it processes the information, and also it will develop an action and learn from its mistakes. For the algorithm to be powerful and accurate, we have to have large data. We have to give large data sets, diverse data sets of high quality, and also it has to have large parameter set of parameters to develop an accurate algorithm and to be powerful enough to generalize these results if we have new input. So after completing the training stage, it will be applied in the digital signal processor of the hearing aids. Advances in algorithm, computing technologies, and digital data in recent years have allowed AI to permeate many aspects of our everyday lives. The hearing aid industry is no exception. Edge computing moves computation closer to the edge of the network. So as for hearing aid, it will be on the level of the processing through the hearing aid directly without the requirement to be connected to a smartphone or a cloud-based data center. AI has the potential to transform hearing aids from traditional prosthetic devices into intelligent augmented sensors. I will talk about one of the main rules of AI in hearing aids is the acoustic scene classification, where it tries to mimic the auditory system ability to classify the different sound sources in the environment. The acoustic scene classification is one of the most important parameters or uses of AI in hearing aids, where it will classify the different listening environments and apply the suitable parameters for sound processing. So it will use through feature extraction and patterning according to the different acoustic parameters of the sound, the temporal and spectral parameters. It will develop an internal classification system, which through it will classify the different acoustic scenes. AI also enables the creation of more personalized and adaptive solutions, tailoring amplification and noise reduction algorithm to the unique need of each hearing aid user in any given auditory environment. So AI can help when automatics fail to accurately capture the user listening need, intent, or preference. Moreover, with their continuous learning capabilities, AI-based hearing aids could improve their performance over time, gradually perfecting the listening experience. So it doesn't only depend on classification, the acoustic scene, it will also have the tailor according to the preferences of the listener and its need. So AI help for produce more natural sound processing that adaptively respond to real-world environments, improve speech perception, especially in different environmental settings, increase the ease and hearing accuracy in real-world environments, improve noise reduction, enable simple and dependable streaming directly to the hearing aid. Also, it will improve the customizability of the hearing aid, offering personalized hearing aid adjustments based on the user preferences. It will reduce the need for manual adjustment by automatically adapting to the wearer. This will also improve the fitting process, and it will reduce the need for repeated office visits through also remote monitoring. Also, there is multi-motor sensors, as there can be acoustic sensors, but there can be inertial sensors. This will be used to optimize the speech intelligibility and noise. So we can take the information from the motion sensors with the information from the acoustic sensor with the classification of the acoustic scene to choose, for example, the directional patterns. For example, if we have a patient who is stationary with one speaker, so we can activate the directional pattern, for example. So it can use the information from both sensors to optimize speech intelligibility and noise. Also, it offers comprehensive health and wellness monitoring through physical activity tracking and fall detection. Also, it has a full alert system where it can alert the designated contacts that a fall had occurred to the patient, and also send GPS location. Also, it can assess the social engagement assessment, where it can tell us how many times he wear the hearing aids, how many hours per day. Also, the different environments he is engaged in, and the type of environment containing speech. This would be used for counseling the patient to wear more hearing aids and converse and to engage in conversations. So what the future research is hoping for AI? Currently, they're working on integrating the brain-computer interfaces. One of the challenges to classify or to hear in multi-talker environment is which sound to attend to. So they are trying to put or to read the brain EEG through applying electrodes in the hearing aids. So they can determine the fluctuations in the brain neural activity if it's matching the fluctuations in the sound. So this is the sound to be attending to or to be amplified. Also, by improving the real-time processing capabilities to achieve the full capabilities of the deep neural networks, we need large hardware power, which will consume the battery. Thus, to achieve the full potential, there is still some development in this area to further enhance the personalized sound environments. So to conclude, AI is a technological breakthrough that has enhanced hearing aid capabilities, decreasing listening effort, and enhancing the hearing aid user quality of life. As AI technology continues to advance, it's important to highlight the significance of the combined efforts of innovation and skilled hearing care professionals to ultimately benefit the hearing aid individual. Thank you.
Thank you, Dr. Abir. We'll go for the next presentation, AI in vertigo and balance disorders. It will be presented by both Professor Dr. Hisham Taha, Head of Audiovestibular Medicine Department, with Dr. Noha Shafi, Lecturer of Audiovestibular Medicine at Ain Shams University. Please proceed, Dr. Hisham.
Good morning. It's a pleasure for me to be with you today. My presentation will be joined with Dr. Noha Shafi about the role of artificial intelligence in vertigo and balance disorder. And Dr. Noha will talk mainly about vestibular rehabilitation. We all know that vertigo is a symptom of feeling that the patient is spinning or swaying or illusion of movement. It's very common disorder affecting many patients, and it's the most common cause of patients referred to otorhinolaryngology clinics. The diagnosis is usually challenging of vestibular dysfunction, and there may be some critical decisions as to differentiate between peripheral and central vestibular lesions, especially in acute vertigo syndrome. So artificial intelligence may have an important role in different issues as regards to diagnosis and management of dizzy patients. As regards to artificial intelligence, it refers to the development of computer systems that can perform tasks that typically require human intelligence. It's very important for us to know that as regards artificial intelligence, we all have the machines to diagnose vestibular disorders, either VNG, rotary chair, VHIT, dynamic physiography, but it's very important also to have a clinical sense. Okay, artificial intelligence give us prediction, but it's also important to have a clinical sense in order to reach proper diagnosis. As regards to artificial intelligence, there is learning. It's as regards to that the system can learn from data and improve their performance over time. Problem solving, the system can analyze complex problems and provide solutions. Reasoning, the system can draw logical conclusions and make decisions. Perception, the system can interpret and understand the data from sensors, images, and other sources. If we gather all this, we can find that these items may be present in each device that we can use in diagnosis of dizzy patients. The types of artificial intelligence, either narrow or weak artificial intelligence designed to perform specific tasks such as spatial recognition or language translation, general or strong artificial intelligence, which aims to create machines that can perform any intellectual tasks like humans. I'll not go in details. I'll go directly in vestibiology because we are out of time. In vestibiology, artificial intelligence-based expert system can be designed to take decisions as human experts. The first publication was in 1990 by Mira et al. As regards to machine learning algorithms, it also I think it's present in all the devices that we use. Okay, so it can be used to data analysis, automated vestibular testing and interpretation, improve accuracy and efficiency, and can be used to visualize and understand, classify clinical data to create computerized, faster, and more accurate evaluation of dizzy patients. In the future, deep learning of nystagmus analysis or automated nystagmus analysis program are expected to develop to overcome the shortage of specialists and rapidly increase the number of dizzy patients. I now invite Dr. Noha to complete.
Thank you, Dr. Hisham. Now I will continue the role of AI. I will focus on AI-powered vestibular rehabilitation. We know all that vestibular rehab is a safe, effective, non-invasive technique for management of various vestibular dysfunction. VR is an traditional vestibular rehabilitation is an exercise-based treatment programs designed to advance the natural process of vestibular compensation after acute vestibular disturbance or chronic imbalance. Vestibular rehabilitation is a specialized form of therapy intended to attenuate both the primary and secondary problems caused by vestibular disorders. It integrates the proprioceptive visual and residual vestibular functions to improve the balance function, including gait, gaze, stability, posture stability, physical mobility, and function with activities of daily living. Limitation of traditional vestibular rehabilitation. However, vestibular rehabilitation can improve static and dynamic balance and gait. Also, it reduces the comorbid symptoms of dizziness as depression and anxiety, which ultimately result in an increase of self-confidence and quality of life sufferers. However, there are many factors that may negatively affect the outcome of vestibular rehabilitation, as incorrect performance of exercise and the necessity of active efforts and interest of patient. With the recent development and improvement in sensory devices, wireless communication technology, and 3D computer simulation technology, virtual reality is one of the examples that has been developed as a new therapeutic method. Virtual reality is an innovative approach of vestibular rehabilitation that combines immersive technology with traditional therapy techniques to improve balance, reduce dizziness, and enhance the overall vestibular function. It's defined as a high-end computer interface that involves real-time simulation and interaction through multiple sensorial channels. It provides feedback and also allow a more stimulating and enriching environment than usual rehabilitation. It can measure and track exercises and allow virtual experience of activities of patients that might otherwise not attempt. It's widely applied technique for generating a virtual environment using different forms of display, whether spherical, flat screen, or head-mounted devices. The user interact with object in visual realities using his body movement. Many studies were done exploring the efficacy of virtual reality in vestibular rehab as a rehabilitative tool, but there are no standardized guidelines settled in the literature, and also there is high diversity of setting and protocols involving virtual reality setting for the treatment of this pathology. As we said, it's a based rehabilitative therapy. It's one of the innovative and promising recent development in rehabilitative, in which the user interact with displayed images, moves, and manipulate virtual objects and perform other actions in a way that attempt to immerse them within the simulated environment. Therapy engendering a feeling of presence in a virtual world. It can be equipped with real-time simulation, interactive functions, and game features to enable adaptation, habituation, substitution exercises for vestibular rehab. It includes immersion, which is known as the presence. It's a feeling of being present or being part of a computer-generated world. Interaction is a communication of a person with a system through 3D means like head-mounted devices and space ball. And finally, imagination. It can be seen as the thought of a system designer to perform a particular goal and ability of the subject to visualize channels through a variety of thoughts process. These are the basic components of virtual reality system: a computer, display device, interface device, and navigation devices. These are the components. What it can add: immersive environment. Visual reality headset can immersive interactive environment that simulate real-world scenario. Customizable scenario. Therapists can design personalized scenario to address specific vestibular disorders such as benign paroxysmal positional vertigo, labyrinthitis, or vestibular migraine. Real-time feedback. Sensor and tracking system provide real-time feedback on the patient's movement, allowing the therapist to adjust the treatment plan accordingly. And finally, gamification. Virtual reality games and challenges can make therapy more engaging, enjoyable, and motivating for patients. These are the values of virtual reality that can be used in vestibular rehab. It improves the balance and coordination, reduced dizziness and nausea, enhanced vestibular function, and increased in patient engagement. The advantage of a virtual reality technique used in vestibular rehabilitation, it provides the complete control of stimuli to the subject, so it provides a standardized and reproducible environment. It's often seen as a fun training tool, increasing the motivation of patients to continue their rehabilitation. The gradual exposure to the visual scene may allow individuals to habituate to the provocative stimuli, help diminution of symptoms as symptoms of dizziness and anxiety. It also produces better rehabilitation outcomes because it can promote activities that are essential for rehabilitation. It enhances motivation and enhances upper extremity function, functional independence, and hence better quality of life. Also, it allows greater feedback, more stimulating and enriching development than conventional rehabilitative therapy. Virtual reality and AI-powered therapy. The AI-generated VR environment create a personalized visual reality environments that simulate real-world scenario, helping patients to overcome the vestibular-related challenges. Also, it developed and adjust visual reality therapy protocol based on the patient progress and response. While VR in vestibular rehab shows promising outcomes, more research is needed to fully understand its effect and optimal applications. Ongoing studies are investigating the use of VR in personalized treatment plans, developing tailored and customized VR protocols for specific vestibular disorders, home-based therapy, exploring the visibility of VR-based home therapy programs, and combination with other therapies, investigating the effectiveness of VR when combined with other rehabilitative techniques such as cognitive behavior therapy or physical therapy. As research continues to advance, VR is likely to become an increasingly important tool in vestibular rehabilitation, offering new opportunities for innovative patient-centered care. Also, telehealth and remote monitoring, AI-powered remote monitoring, analyze the data from wearable devices or mobile apps to monitor the patient progress remotely, enabling time intervention. AI-driven telehealth platforms, it provides personalized guidance and support to patients through AI-powered telehealth platforms. Research and development, AI-assisted vestibular research. It analyzes large data sets to identify patterns, trends, and correlation, driving new insight into vestibular disorders and rehabilitation. Also, it has a role in development of vestibular rehabilitation tools, create innovative AI-driven tools for clinicians and patients, and enhancing the effectiveness and accessibility of vestibular rehab. Conclusion: AI is a transforming field of vestibular rehab, enhancing the diagnosis, treatment, and patient outcomes. Virtual reality is an innovative technique in vestibular rehab. Finally, AI has a potential to transform vestibular rehabilitation, improving patient outcomes and quality of life. Thank you.
Thank you, Dr. Noha. Thank you, Professor Hisham, for your interesting talk. I'll leave the floor for Dr. Dalia, because unfortunately we had a last presentation by Dr. Lamis and she was stuck in the traffic. She couldn't make it. So we'll start the discussion and the concluding remarks.
Thank you, Chairperson. At the end of the session, I'd like to thank all the speakers for their interesting talks. All the talks have raised important questions, important research lines, very actually professional and impressive. Thank you. Very impressive and professional roundtable. Thank you very much. And let's conclude the roundtable and raise questions and open the floor for discussion, please. The role of AI in healthcare is obvious after all these talks. I'm sorry for the dark color. It wasn't like that. Transforming hearing healthcare will not be easy. And there are important ethical considerations regarding the appropriate use of technologies, data privacy, and liability that have not yet been resolved. Ongoing collaboration between AI researchers and hearing researchers would create a win-win situation for both communities and also help to ensure that new technologies are well matched to the needs of users. And we can conclude that, very importantly, that the advent of AI-enabled applications does not diminish the critical role of audiologists. And this was very highlighted by Professor Dr. Hisham Kuzu. And instead, it's an opportunity to take their services to the next level. Thank you very much. And this take-home message, I'd like to open a discussion for my guest speakers, Professor Dr. Hisham. If you want to add a comment, Professor Dr. Wafa, Professor Dr. Hisham Taha, Dr. Noha Shafi, Dr. Abir Mohammed, what do you think about this home message? And if you want to add, and if our colleagues and professors assisting the roundtable want to discuss any issue, please. And also to give questions for the speakers. Yeah.
Thank you, Professor Dalia. I totally agree with you. All the remarks are correct. I want to add some comments regarding AI in audio vestibular medicine in general. We use in practice electronic devices, and also we prescribe electronic devices. So our specialty is affected aggressively by technology and the advances in technology, including AI. And as we said, that AI is present in every subspecialty of our everyday practice. So I encourage juniors to learn AI, to know what's the concepts of AI, to know how to use the AI concepts in electronic devices we prescribe and electronic devices we use for management and diagnosis, because this will affect their degree of skills or the use in their everyday practice. This is important.
Okay, thank you. And from your professional experience, what do you think, in which era and which branch of the audiology the AI will, in the coming years, will validate or will dominate, or in all areas?
All areas will be affected, because we use technology in every aspect of our practice. You are always looking at the screen or using an electronic device. It's technology, and AI will affect all subspecialties and all aspects of technology in general.
Okay, thank you, Professor Dr. Wafa. For you, what do you think the AI will be implemented and will be dominating the coming years in which audiology subspecialty? Audiovestibular subspecialty. It was open already. إيش؟ لا حضرتك قربي بس.
Yes, I agree with Dr. Hisham, what Dr. Hisham has said. But for the AI, it's very, difficult to understand.
Yeah, in our facility, what's missing and what we need to augment and what's present. We have missing points, but we have a collection of data. We have a database. We have professionals that can work in a good way. What do you think?
To learn more. We are professionals lacking this information still yet. So we have to learn more about the auditory, the AI, and understand what's the importance of using it in big data collection. This is one of the things that is in Paris. They were talking much about this, the big data collection, and there were many sessions concentrating on this. It's very difficult, something that is outside the scope of our practice, but we have to go with the recent advances in the big data collection, whatever the area is in audiology.
I think the first step that we'll get a trip to Alexandria University to take practical courses and private courses about the AI from Dr. Hisham Kuzu. And before giving the floor for Dr. Hisham Taha, I'd like to give a question for Professor Dr. Amani. Professor Dr. Amani, from her experience in the central field, what do you think the AI in central auditory processing disorders have a role now and in the future, please?
Yes, but still we have a little knowledge about this. But yes, it should be. We need something else. We need to
current situation. What's the current situation in CAPD?
Yeah, but before this, we need to do something else with learning the artificial intelligence. Communicate with other professions like the mathematicians, the computer science, the physicists, because they are more. They have more knowledge at this era, so they can go up with steps with us more than only taking us the knowledge of this. Our situation now, yes, we started to put the computer-based programs in the APD, but with this very primitive level and stages. We need to do other research work to take more data from centers all over Egypt, number one, and over the Arab world, so they can fit to do a big data and to be analyzed and go through the step, because still although there is artificial intelligence and machine learning and deep learning, but still the role of human creation in the field of central auditor processing beyond this, for my thinking. Maybe I am a little bit biased by this, but the connection in the brain and when we study the neural networks and the communication between the centers in the brain, it is still the human creation has a role in the central auditor processing field than the machine. But we need to apply this with other field and the knowledge to have the proper program to diagnose and rehabilitate earlier.
Yeah, and I think we uploaded the CAPD on this
Right.
on the internet on the cloud system.
Yes.
So it's a type of AI in implementation and rehabilitation of central auditory processing disorders. Yeah, thank you very much, Professor Dr. Hisham. What about the vestibular disorders? I think it's a little bit far.
No, it's not a little bit far. As Dr. Hisham told us, it's present in everything in life, and in our specialty, deals with electronics, either in diagnosis or rehabilitation. All our equipment have some sort of artificial intelligence, but it's very important to have clinical sense. The computer tells you.
Yeah, okay.
The computer tells you that this patient may suffer from a problem. As for BNG, there is saccadic abnormality, for example, but you can see by your eye that this is not abnormal. So I think you have to gain clinical sense. This is very important in order to guide the equipment or to repeat the test if there is a problem. Second, for vestibular rehabilitation, I think computerized systems utilize artificial intelligence, as Dr. Noha presented. And I think in the future, there will be a great role, especially in diagnosis and rehabilitation of vestibular and balance disorders.
Okay, thank you, Professor Dr. Raja. You want to add a comment, please?
It's a small comment actually.
Yeah.
إحنا generation who started the technology from zero أو from scratch. إحنا شفنا الكمبيوترز وهي بتبتدي وشفنا يعني بسرعة. خليها هيدن كده يا دكتور. still هحطها كلها مع بعضي عشان بالظبط كانت بيبر ايوه وترانسبيرنسي نعمل بيها برزنتيشن خلاص بقى كده فبليز الجنريشن الصغيره they do trust the system so much trust your brains لان هي creating the system trust your skills ان انتوا physicians trust your brains as I said and that will help to innovate مش العكس.
Yes, thank you. And Professor Dr. Ali, of course. لا حضرتك اتفضل.
ولو سمحتوا لي طبعا I'm very impressed بان يبقى في سيشن اساسا عن artificial intelligence which is a sign of اننا updated وماشيين يعني على الحديث. I have to comment بس واقتراح يعني. الكومنت هو انه I would like to add انه اولا الورك اللي استعرضته الدكتوره وفاء ممكن كان بي applied للهيرنج ايدز. It's the same concept. وميزه فيه مش بس بريدكتيف اناليسيس لكنه كمان بيبقى زي بنش مارك. انت لما بتعرف المفروض البيشنت ده يروح فين فانت تقدر تحاسب نفسك تحاسب السنترز المختلفه are they doing good ولا لا. فيبقى واضح الامر ده بيعمل مور efficiency اكتر في اليوز اوف فاينانشال ريسورسز. بقى احنا بنمول مثلا الدوله على هيلث سيستم كبير مول كوكلير امبلانتس. طب هل يا ترى بتروح في المكان الصح ولا في اهدار للاشياء دي؟ فبالتالي هيبقى في يعني فوكس وفي سبوت لايت على الاماكن اكتر فتبقى واضح الاداء بتاعها احسن ايه يعني مظبوط ولا مش مظبوط ولا دي بوينت مهمه يعني في موضوع السكورينج سيستم او اليوز اوف ارتفيشال انتليجنس ان بريدكتيف. الحاجه الثانيه بقى الاقتراح اللي انا عايز اقترحه اننا
I think البوينت اللي حضرتك بتتكلم فيها هتندرج تحت الethical considerations from all its aspects.
مش بس من الناحيه الاخلاقيه طبعا من الناحيه الاخلاقيه لكن كمان حتى من الناحيه البراجماتيه العمليه الحسابيه يعني ده هيحسن الاداء definitely. الحاجه الثانيه ان احنا I think we should enroll بقى الحاجات اللي هي زي الارتفيشال انتليجنس should be enrolled في الاديوكيشنال بروجرامز بتاعتنا، سواء كانت الماستر ولا البورد ولا نسميه زي ما نسميه ولا الماجستير ولا الدكتوراه. ليه ما يبقاش في elective كورسز عن الحاجات اللي زي دي؟ يعني لازم الانتر بروفيشنال اديوكيشن دلوقتي
تبع ريسيرش ايثيكال، مش تبع ريسيرش. عندنا احنا في بروجرام في عين شمس اللي هو الريسيرش والستاتستكس، ففعلا ممكن تبدا تدخل فعلا تبع
لازم
الماستر.
جزء اساسي من تاهيل الاجيال اللي هي رايحه للجي.
يعني احنا ما ينفعش حد ياخد ماستر ديجري الا لما يكون معدي في ليفل معين بتاع الريسيرش كورس ده، فممكن ينضاف فعلا.
يبقى جاهز بس للمستقبل. بس شكرا.
ثانك يو دكتوره. اتفضلي يا فندم.
الجزئيه طبعا ان هو يدرس الارتفيشال انتليجنس، لكن الجزئيه الاهم هل نستخدم الارتفيشال انتليجنس في الاديوكيشن ولا لا؟ دي يعني معضله كبيره جدا في العالم كله، مش عندنا بس. انه يعني زمان عارف حضرتك لما كانوا بيمنعوا الطالب يدخل الامتحان بالكالكوليتر ويقولوا لا انت لازم تحسبها، وبعدين لقوا ان هو مش لازم يحسبها، مش لازم يحسب ده ما دام معاه كالكوليتر، يعني هو مطلوب منه حاجات ثانيه غير انه يقعد يحسب. الكونسيبت دلوقتي نفس الكلام بيتقال على الارتفيشال انتليجنس، انه انا عشان اعمل سيرش او اعمل انا يعني في ناس with الارتفيشال انتليجنس بيقولوا لا انا لازم استخدم الارتفيشال انتليجنس في الريسيرش في الاديوكيشن، في الريسيرش وفي الاديوكيشن، وفي ناس بتقول لا انا لازم استخدمهم. المعضله دي لسه ما اتحلتش في العالم كله اللي هي حضرتك بتقولي عليها كده.
ما هي لو بدانا في الستادينج وفي في الاديوكيشن زي ما حضرتك بتقول، اكيد هتدخل في الستيب بتاع السكورينج وفي الاكزام. فاحنا كده
في ابلكيشن اسمه هيومنايز، سمعت عنه؟
لا للاسف.
يعني بقول له انا عايز ارتكل عن مثلا سنترال اوديتري بروسيسنج في الاطفال،
زي حاجه زي الشات جي بي تي كده.
هو
يعني الشات جي بي ده ده كارثه.
الموضوع دلوقتي اللي هو الديب سيك اللي هو التشاينيز فيرجن. الديب سيك ده فبيعمل ايه؟ يعني حضرتك لما بتبعتي الارتكل دي للمجله بيشوفوا
بلاجيريزم،
بيشوفوا فيه ارتفيشال انتليجنس. هيومنايز ده بياخد الارتكل ارتفيشال انتليجنس يخليه هيومن. فالارتفيشال انتليجنس تولز اللي هو عارفها وعارف ازاي بتدور، فبيعمل باك دور لها يبقى الارتكل هيعدي، يعني الدنيا ماشيه في سكه ثانيه.
ودلوقتي بقى تكمله كلام حضرتك بعد اذن حضرتك، البرزنتيشنز انت ممكن تديله الداتا اللي انت عايز تقدمها وهو بيعمل لك باوربوينت برزنتيشن يقول لك اتفضل. ففعلا
هو طبعا هو يعني لسه الايثيكال بارتس دي مهمه جدا، لازم نتفق عليها. يعني هل ده مسموح ولا مش مسموح؟ لانه لو احنا منعناه هيبقى موجود بس بطريقه اندايركت. موجود، ما هو موجود دلوقتي.
طيب we need one word from طب دكتور ايمان اتفضلي.
الاديوكيشن في الكيندر جاردن والسكول ايج تشيلدرن كانوا بيستعملوا موستلي حاجات كمبيوترايز وشويه من اي اي، وبعدين عملوا دراسه قالوا لا وي هاف تو ستوب ذس، مش هنستعمل التابلت، مش هنستعمل الاي ليرنينج من الهوم، ان الاتندنس السكول والكوميونيكيشن ابتدت تبقى مش كويسه، فابتدت ان واي ستادي كده اتعملت في السويد لا هنرجع تاني للبرين كرييشن مور ذان ديبندنج شويه. هي الديبيت موجود، يعني في ناس عايزه الارتفيشال انتليجنس تكمل في الوورد وورد، في ناس تقول لك لا انا هبقى كونسرتيف شويه. طبعا الايثيكال
considerations مهمه. one word for دكتوره نهى and one word for دكتوره عبير because دكتوره لميس الحمد لله has arrived and she will give us her talk in a shorter time باذن الله.
هو الاي اي طبعا احنا ستيل فيري بور
قربي المايك.
بس استخداماته بصراحه
انفيرتايجو
هو من اول، هو استخداماته من اول التيتشنج، يعني من اول احنا كاكاديمكس محتاجين ان احنا ندخله بشكل او باخر بالتعاون بقى مع كمبيوتر ساينس او كده، ان احنا محتاجين نتعلم، هيبقى له ابلكيشن كتير من اول التيتشنج في الدايجنوزس في الريهابيليتيشن، هيبقى ان شاء الله هيبقى له.
اوكي دكتور عبير one word about the hearing aid.
I think
the current one in one word and the future in your all your readings and all your deep knowledge?
I think AI already has عملت great innovations in the hearing aid field, which impacted the benefit on the hearing impaired user. I think now AI is beneficial, and the future can be more advanced. With the more advanced technologies, it can be, I don't know, it can be unimaginable.
يعني دلوقتي الهيرنج ايدز بقى فيها ترانزليشن فدي يعني ما فيش بعد كده يعني. Thank you very much, and last but not least, Dr. Alamis, give us your talk in a very short time, please.
I apologize for the delay, but I have this emergent issue. So I'm going to talk briefly about AI as a smart tool in center auditory processing. We all know as humans that audition is our primary mode of communication. However, audition can be challenging or difficult in many situations, including very low speech, degraded speech, or noisy situations. Thus, the auditory pathway is packed with multiple relay stations. These multiple relay stations perform processing, which is serial, parallel, and extensive within these auditory areas, and even with other areas of the brain, including the motor areas and other sensory areas. The recent advances in human connectome and the cortical topography has even revealed that these connections and these processing and these trajectories are even much more complicated than we previously thought. And AI, I'm not going to elaborate about AI because I know my professors have already elaborated. AI has many applications in different fields. We can make AI models by using the data sets. AI can understand these data sets, can analyze these data sets. It can classify and make predictions, and even can automate tasks within based on the data sets applied. But the application of AI and machine learning is different for every domain of life. So I'm going to focus today about central auditory processing. Briefly, I'm going to remind you of the CAPD flow chart. In order to, we start with CAPD evaluation by collecting the data. The data comprises history, questionnaire, observation, comprehensive psychophysical and electrophysiological tests. So it comprises a big test battery that can be varied or manipulated according to the response of the patient. Then the second step is interpretation of this data by profiling or classification. Then the formal diagnosis of CAPD is to be labeled, followed by the intervention by both training and other measures like environmental modifications and metacognitive strategies. And the final step is the follow-up and monitoring of this process. So where does AI apply here? So the application of AI in central auditory processing are scarce. However, there are two applications. One here in the interpretation or in the profiling of data, and the other in the intervention or the training program. The other steps of CAPD assessment or CAPD flowchart hasn't been tapped yet by artificial intelligence. So I'm going to present the two papers or the two projects. Project one was, I cannot pronounce the name. These authors in 23rd, under the name of using machine learning to assess auditory processing evaluation. And this was published in Frontiers of Audiology in 2023. So they collected the data from 134 child, referred from APD assessment. This is a retrospective study. They have offered this data to an expert audiologist and offered also this data to the AI models. The data of these children were labeled and received diagnosis of APD by the expert audiologist and the machine learning models. They have used two ensemble learning techniques, and ensemble learning techniques mean that the machine learning is going to understand and classify these data sets. The first one is random forest, and the second one is XGBoost. The first one is based on artificial model of bagging, which compensates for missing data. The other artificial intelligent model, XGBoost, is based on boosting machine learning models, and this model acts on reducing the noise of data. They have fed the data to these models and gathered the output, our classification of these models. So the labels were behavioral abnormal and physiological abnormal, behavior abnormal and physiologically normal, behaviorally normal and physiologically abnormal, and finally abnormal in both behaviorally, normal in both behaviorally and physiologically. The next steps is that they compared the labeling made by the expert audiologist and the labeling made by AI models, and found these and concluded these confusion matrix, the diagonal line. The diagonal line represent correctly identified profiling or classification by AI models, and the side numbers are the wrongly classified models. So we can see that most of data in the first model, which is RF model, was correctly profiled, similar to the expert audiologist profiling, while the other AI model, XGBoost, has also a large number of correct profiling. However, the wrong profiling of data was larger compared to the previous to the RF model. So they concluded that also they provided sensitivity and specificity for both models. Random forest had also higher sensitivity, specificity, precision, and markedness compared to XGBoost. So they concluded.
معلش we have 5 minutes علشان الاوبننج سيرموني بعد كده.
تمام. خلاص قبلها ان شاء الله. So they concluded that the application of machine learning is comparable for diagnosis accuracy of ABD by physicians, and also they recommended that to use these AI models as a training platform for audiologists who have no access or have limited access to central auditory processing data. The second project was done by Ingrid Gilo, and she has, with her team, developed an AI-based platform for auditory processing training. The platform is fed with the data of the patient. It plans and offers the training for the patient. So they gathered 32 adults, have undergone assessment of CBD. They were divided into 2 groups, a research group and control group. Control group received the validated training program for APD. The research group received the AudioFoco platform, which is the AI-based platform. They have performed 1 month training, 8 sessions for 30 minutes. Post-training improvement was comparable with no statistical significance difference between groups in sound localization, auditory closure, temporal frequency ordering, and hypotic digits. So to conclude, they concluded that AI platforms offer promising tools to individualize training plan for individuals with CABD. So what are the future directions? Multimodal AI, in which not only the auditory domain is, the data of the auditory domains are utilized, but also the visual domain or other sensory domains. Also generative AI, where AI can generate new data and compensate for the missing data in our data sets. And finally, collaborative framework, where the expert clinician and the AI stream their data together and make decisions by each side. Concluding remarks, AI offers a promising tool to aid in CABD assessment and management, and AI undergoes massive advancing steps which hold premise for more integrated rule in the future. Thank you.
Okay, thank you, Dr. Lamis, for your presentation. I think we have to conclude the session بتاعنا. Thank you for Dr. Dalia Hassan, moderator. Thank you for the speakers. ننزل بقى. دلوقتي هننزل عشان الاوبننج سيرموني في المين هول. Thank you.